The reason that we do play therapy with children is because children develop cognitively before they develop verbally. And so play is their natural language.
I know that it's been a great resource to me as a parent and as a professional, and I think that one of the best things is it is a very good outlet for kids to be able to express themselves and to be able to get some emotional wellness, and the university has an excellent resource for that here at the clinic with the people that are trained here and then the students who come through this program.
All too often we think that oh, they're kids, you know, they don't understand it, or they don't really get what's going on. And while some of that may be true, they may not exactly understand what's going on around them. They do pick up on the significant adults around them and the feelings that they're having.
With play therapy, we do see more than just play. Play is a way for a child to express themselves, and normally we find themes in their play. We have different themes in that play, like nurturing or aggression and anger. There's expressive arts, there's so many different things, and we can use those different themes to help figure out what the child is dealing with and how we can best treat that child.
And when a parent contacts me about doing play therapy with their child, I always explain that the process in terms of play is their language and toys are their words. And so what are they trying to tell me with their play that maybe they can't express another way? And you know, well-meaning parents will even say, what's wrong with you? Why are you acting this way? And a child can't always articulate it, or sometimes they don't even know. I believe that all behavior is purposeful, and so in their play, those behaviors naturally come out. The magic of the playroom experience is that as they build a trusting relationship with the therapist provides a safe place for them to express their feelings. Then they learn a different way of being. They learn self-control through their relationship with the therapist, and the therapist using their skills to help them with that, which is very important, because we're not always going to, you know, as a parent, I won't always be with my child when someone tries to get them to do something that could hurt them or whatever. And so I really want him to have developed a sense of self-control and an awareness of making choices for himself, so that he's not always dependent on me to do that for him. So that's part of why we do play therapy with children. I think that play therapy can benefit any child. I think some reasons a parent, in my experience, reasons that a parent would seek out play therapy for their child would be, you know, some of the obvious things are family changes, divorce, death in the family, abuse, verbal or physical sexual abuse, any of those kinds of things. From a parent perspective too, I believe nobody knows their child like a parent does. A parent is really the professional on their child. I have a set of skills that hopefully I can use to help them with their child, but really a play therapist is a partner in the process with that parent, because I can use my skills and knowledge and meet with the parent and say, okay, here's what I'm seeing, does that fit with what you're seeing? And then from there make some suggestions for ways that maybe they could change things. But you know, as the professional on your child, you know when something's just not right with them, when you see a sudden change in behaviors that seems like more than those developmental shifts that all kids go through when they're growing and changing. But as a parent, you know when their behavior is changing in a way that doesn't feel okay to you, and especially duration. If it's gone on for longer than a few weeks, if it's gone on for a month, if it's gone on for longer than a month, then probably it's something that you should at least talk with a therapist about and see what input they have, if it feels like perhaps you need to seek more play therapy or not.
Several months ago, we were going through a transition. We were moving. He was getting ready to start a new daycare. I was going back to work, and he asked if we could have some playtime. He started immediately, picks up the baby doll and starts screaming at the baby doll, "Listen to me, listen to me." And it really made me as a parent even stop and think, whoa, we've been so busy and things have just been so chaotic that he really hadn't been feeling heard. And so as a mom, it was a little bit heartbreaking, but then from the clinical side of it, I was able to see that that was him communicating what to us through play what he had been doing acting out in other areas of our life. So it gave me the ability to be able to step back and say, this is something that as a parent I need to address in a different way. We started spending more time including him in the planning, and it made a difference.